At an interagency press conference today, Cascade County and Great Falls officials addressed the recent rise in COVID-19 cases and the possibility of future restrictions. Here's what some officials had to say.
I think we're considering all kinds of restrictions at this point. We're not looking at a shutdown like we had back in March, but we are looking for different ways to be able to keep this under control.
According to Cascade City County Health Officer Tricia Gardner, Cascade County has reported just over 1,300 confirmed cases of COVID-19. Despite that, restrictions on gatherings or bars and restaurants aren't coming just yet.
We have to look at all options to help curb the spread of this virus.
Great Falls Public Schools Superintendent Tom Moore reaffirmed the district's commitment to staying open for in-person learning.
In conjunction with advice from all of our healthcare folks, we're going to keep schools open as long as we can, as long as it is safe and manageable to do so.
For me, this terminology, exponential growth, was something I needed to look up again so that I understood what it meant.
Officials from several healthcare organizations in Great Falls emphasize the stress that hospitals are under and ask that asymptomatic patients stay home.
There's more people coming in than what are leaving. It is getting bigger and bigger, and it is putting a burden. We're working through it. We're being very conscious of our resources and working throughout the state. That is my biggest plea for everybody, that we're maintaining and we're doing our job, but we're getting stressed and we need some help. And that help is to stay home, wash your hands, wear your mask, and social distance whenever possible.
Officials from the Great Falls Clinic, Malmstrom Air Force Base, and Alluvian Health spoke about how maintaining the spread of this virus is a community effort. Dr. Richard Geyer, an infectious disease expert from the Great Falls Clinic, said that while people over the age of 70 and people who are overweight are at the biggest risk for COVID-19, him and his comrades in the healthcare industry have seen perfectly healthy people impacted by COVID-19. Reporting live in Great Falls, Matt Holzaffel, MTN News.
Well, thank you very much, Matt. Well, earlier this week, a Benefice employee reached out to us saying they were confused about whether they should quarantine after being exposed to the coronavirus. Now, at today's press conference, Benefice cleared up some of that confusion. The chief medical officer at Benefice said employees who are exposed to the virus but don't have symptoms will most likely still have to work. Now, for most people, getting exposed to the virus by being in contact with a positive person means you have to quarantine for 14 days. But for healthcare workers, the rules are a little different, especially when they're short staff. Now, up until today, Benefice said they were following CDC guidance to keep their employees safe, but they hadn't told us which guidance they were referring to. Benefice Chief Medical Officer Dr. Bridget Brennan says it has a lot to do with staffing.
If we consider potential exposures as something that mandates a 14-day quarantine, we would not have a hospital or a staff to run the hospital. If you're symptomatic, you're not working. If you are positive, you're not working. If you have a potential exposure, there's a good chance we're going to have you work.
Now, Benefice is asking employees who have been exposed to monitor your symptoms daily and get tested if any develop.